and all agree that we all have great ideas and walk away, and then we don't have to have a debate. But it is my feeling that, I mean, we have three parties who are presenting very similar ideas and very similar messaging to the Canadian public. So that my job is to let these people know the differences. I mean, we can all say that we're awesome
I'm going to argue
and go
with that.
home.
I'm going to argue with that, and I think it's some of the problem with our government that in fact parliamentarians, and Carolyn will speak to that, I'm sure parliamentarians say when they leave Parliament and they do their exit interviews that the floor was awful, the bashing, the taking of everything my party says is completely right and everything the other party says is completely wrong was awful, was unproductive, and it's some of the reason why we see this ridiculous schoolyard bullying that goes on in Ottawa.
Okay, well,
and we're
I can be nicer.
Can I finish? And we're ashamed, and it's why youth, I think, is disaffected and doesn't vote. And those same parliamentarians say that the best time they had in Parliament, when they made progress, is when they worked on committees. And I'm sure Carolyn will say that, when you worked with the current Minister of Health and you worked together to come up with plans to go forward for Canada.
That's not been so easy.
Yeah,
Before this government, it was very easy.
Yeah, and so I'm just saying, let's kind of just change the channel on always attacking one another, and let's find ways of, let's use this debate to say we share a lot in common, and they're all good ideas, and bring them forward.
All right, so I'm just going to redirect us back to the question in perceiving the most pressing issue in the healthcare system. And so, Michael, did you have a 1-minute response you would like to make on the pressing issue in healthcare?
Well, there were a lot of questions asked of me, actually. So.
Okay, which question would you like to answer then?
Well, I think the next question will address what Dr. Bennett mentioned, so I can leave that. But I will say that, you know, I'm sorry if I feel strongly about this, but I think that healthcare has been one of the most important pieces of a consistent NDP platform since the inception of the party. So when other groups take on some of those mantras and are taking that same language and that same position and moving forward without the action behind them to support it, I have to say that.
All right, other responses or questions?
Well, I think there has to be a bit of a fact check in terms of what the 2004 Accord meant in terms of putting $42 billion worth of money back in and actually committing to a lot of these things. I also think that it's not helpful to be saying in terms of Lester Pearson putting in Medicare, it did come in a Liberal government with the help of the NDP, and that's surely a good thing. And that's what we're trying to do. It wasn't a coalition. It was a minority government working properly across party lines. So again, it's I think really important that we come together. And the problem with the Conservatives not being here tonight is that this is not working in terms of what the biggest threat going forward is to have a government that thinks that everything to do with health and healthcare is provincial and has wrapped themselves in some sort of constitutional flag saying, oh, not my department, the provinces will do that. And the other piece that they've done, thinking that they're getting off the hook with the 6% escalator and taking credit for a 30% increase in funding, which means 5 times 6% equals 30. I mean, it was legislated by our government. They couldn't get out of it like they got out of childcare in Kelowna. And I think my concern is that it says right in their platform they'll respect the federal spending power. That means all of the programs that we are funding right now, through the Public Health Agency, through Health Canada, the Little AIDS Prevention Program, a church in Wellesley, all of these people feel that they will be hit. They cannot find that $11 billion hole in their platform without touching health and health care. 80% of the federal government budget is on things they can't touch, EI, CPP, all of that. They can only play at the margins, and there's no question that their understanding of health and healthcare is the biggest risk to this country, and particularly today when they've unearthed Stephen Harper's praise for David Gratzer's book, Code Blue, saying that prescription, which is clearly on two-tier, should be embraced instead of the Canadian healthcare monopoly. So one of the, maybe it'd be more therapeutic if every other question we could bash the Tories. But I think it's not fair that we're fighting against one another when we would rather join hands and sing Kumbaya or some sort of. So let's go forward. But we cannot let them off the hook, because if healthcare is going to be we need it to be a ballot box question, and we need all of you to help us, because the Conservative voter suppression tactic, which means they don't want you to vote. They don't want young people to vote. They don't want tenants to vote. They don't want Aboriginal people to vote. The lower the voter turnout, the better it is for the right. And so we have less than 2 weeks to get everybody to understand that Medicare is at risk, the CBC is at risk, everything that we care about in this country is at risk if we let these guys carry on with their lying and contempt of Parliament.
Thanks, Dr. Bennett.
I think it was more
and I agree.
Everyone seems to be nodding. Yep. So we have two more minutes left to discuss. So I don't know if Dr. Wolcott-Uligu, you have something to say.
Yeah, I just wanted to mention the Fraser report that suggested that what the government do for the next 5 years is allow provinces to experiment with private healthcare. And that has not as yet, by the time I left home anyway, been condemned by the Conservative government. And this is in your future, and you as physicians, I think, are going to, unless it's in your hands because it's in your ballot box, but if not, you are going to have to deal possibly with some experimentation of private healthcare in the provinces.
Yeah, I mean, to read it, I mean, you should, I put it up on my website, but the paragraph that says the federal government should, says temporarily suspend the enforcement of the Canada Health Act for a 5-year trial period to allow the provinces to experiment with new ways of financing medical goods and services. So that means this isn't on the delivery side. They're saying suspend it on the single payer side. So we've always had some private on the delivery side, but fiercely defending the single payer system is all we're about. And these clowns are saying, we have asked for Stephen Harper to clarify this. I asked Mike Lake to do that yesterday on Power and Politics, and it's still standing. So whatever rise up we need about this is extraordinarily serious. But I wouldn't think you should, you're busy students, I wouldn't read the rest of the report.
But which obviously we have grave concerns about as well. That again, there's this, we paved the way. I wouldn't say we paved the way. Some of the parties have paved the way for this to head to this crisis. And I think that clearly there's a commitment to free universal health care for everyone in our country. But I do question some of those choices that the previous incarnation of the Liberals made, in the 90s, and even though I said it would be nice, I think that saying that Stephen Harper is bad and anyone but Harper is good, and so you have to vote for your next not as bad option to stop the worst option, isn't the best we can do in democracy. I think in democracy we can actually choose the party that you believe, like after hearing us today, and going and looking online and seeing if we're telling the truth, right? I think that it's okay to actually choose the party that has the strongest position for the pieces you believe in, not the one that is not as bad as the other guy.
And thank you. So on that note, we're going to move on to our next debate question. So as medical students, we're keenly aware that there's a major physician shortage in Canada, particularly within primary care, and the federal government's approach to this issue will directly affect us as trainees. So what our question for you is what is your stance on Canada's physician shortage and medical trainees, and how do you and your party plan to address it? So we'll start again with 2 minutes each, and then we'll have about 10 to 15 minutes for general discussion. Is everyone, I sort of let people go a bit, but is everyone okay with that for now, or would you prefer to be very...
As long as there's lots of time for the audience at the end.
Absolutely,
right?
There will be lots of time for audience in the end. For sure. Okay, so we'll go in alphabetical order by first name, which incidentally means that Dr. Bennett gets to start.